I'm a doctor since 1992. As an interventional radiologist, I became specialized in treating cancer patients. My patients, well, regularly tell me that they think of me as a kind and good doctor. I had a horse cough for about 3 months. Didn't pay much attention to it until January 2016. Then it became worse. For the first time in my life, I had to call in sick for work. Went to my general practitioner and she said, well, I think it's a pneumonia, a lung infection. So I started taking antibiotics. Didn't improve. So then we decided that we should evaluate my lung infection with a CT scan. So I told my son, I'm going to the hospital to do a CT scan to look at my lungs. And I added joking to rule out cancer. Well, he didn't like my joke. After the CT scan, I reviewed the images of my scan with my closest colleagues. And yes, we saw resolving lung infection. And we also saw very large tumor in my left lung, swollen lymph nodes, and some small spots in my right lung. All adding up to a stage 4 lung cancer. So we were shocked, we were panicked, but I needed a treatment plan. So I called one of my favorite lung oncologists, with whom I worked very closely for years. And I said, Jack, can you come over to me and look at some images? I said, can it wait? I said, no, it cannot wait because the images are of my lungs. So within a few minutes, he arrived at our report station and looked at the images and said, yeah, well, the only thing I can treat you with is chemotherapy. It's too large for surgery or radiation therapy. We didn't discuss a prognosis. I think we both knew. So stunned, I biked home, not realizing that a few hours had gone by. I had 10 missed calls of my son. And so the first thing I had to do now was tell my son that his dad had, well, lung cancer. In fact, a scan to rule out cancer had become a scan to diagnose cancer. So how can you tell your loved ones that you're sick, that you're probably going to die because of cancer? As a doctor, I was kind of used to tell bad stories to patients. That the tumor had recurred, that it was progressive, that there were metastases, but I never realized what would happen to them when they got home and tell the bad news to their family. So, well, I was to find out myself. I climbed stairs of my apartment and kind of burst into the room and crying out loud to my son, I have cancer. I kind of shocked him. I should have, well, tried to calm myself down and tell him in a more quiet manner. But I was in panic. I was shocked. Actually, it took me, I think, well, nobody chooses to be a patient. I wanted to stick to my life. So, well, it took me more than a year to admit that I'm a lung cancer patient. And, well, I tried to deny it most of the time. Recently, I had the flu, complaining to friends of mine that, well, I'm never sick, I never have the flu. I couldn't remember when I had flu for the last time, totally forgetting that I'm a lung cancer patient. So how can you be a patient? I'm trained to be a doctor. I thought that I really knew about patients and about their lives. But the thing is, I only saw patients in office hours. It's a very short moment of time during the day. So I know nothing. So how can you be a patient? How, well, was I going to be a patient? So I decided to find some counseling. And the first one I went to was the in-hospital psychiatrist. And she said, oh yeah, bad, sad situation, but you're going to die. Didn't work. A friend of mine advised me to take a mindfulness course. So I looked to a coffee bean for some hours. Didn't work either. So I picked up weightlifting and kickboxing. Although I knew that my body kind of had betrayed me, I realized that I had to stick in, the best physical shape as possible to sustain treatments to cure my cancer. What I never realized as a doctor is that being sick, having cancer, is really lonely. As a patient, I found out that, your life really slows down. You're sick at home or tired, you lie on the couch, and the world is just passing by. And for you, it's a continuous confrontation with a disease. You can run, but you can't hide. You are going to bed with it, and you wake up with it. So, how can you tell as a patient to your doctor how cancer influences your life? I have a cough. Well, I haven't coughed yet, but I cough normally. And the same happens when I'm at Jack's office. I complain about coughing, and classically, I don't cough when I complain to him. And he's a very nice, kind, experienced doctor. So he said, yeah, I understand that it's bothering you. And I always wonder why he's never asking me how it influences my life. So then I tell him myself. I always wonder myself, I told many patients that I really understand the situation they were in. Was I really listening? Or was I just applying the how to be empathetic course for doctors? I think now that being empathetic the way we learned it is kind of blocking and blurring the contact between a doctor and a patient. How empathetic are we if we say to a patient, yeah, we really understand your situation. Now I know we know nothing. So we can sympathize, but we cannot imagine. So, maybe a patient doesn't need a really fake empathetic doctor. A patient needs, I think, a doctor who looks beyond this artificial empathy, who can read the patient, who understands what the patient wants. Some patients, they don't want to know everything about their disease or about their treatment. And on the other hand, doctors, they need the distance too. You can't be too much involved into your patients, otherwise you can't do your job. And I'm treated in my own hospital, so I know my treating physicians, and I'm always amazed that they can keep the distance to me and try to keep me, to treat me the best as possible. I've been operated, finally, or in the end, a few years ago, and I had 2 lung surgeons. And with one of them, he was a very nice guy, but really on a distance. And he said to me, so this is going to be the operation. And I could really easily talk to him from one doctor to another doctor. The second surgeon told me afterwards that he found it very difficult to see me in the operating room, and that he was able to block me the moment I was sleeping and covered with sterile sheets. So one doctor saw me as a patient, and the other colleague saw me, in fact, as a sick colleague. So, I think that as a patient, we should not look for an empathetic doctor. We should look for a sincere, skillful, competent doctor, and it's an additional advantage if it's also a nice doctor. But that's not all. As a doctor, I also took the Hippocratic Oath. Some call it the Hippocratic Oath, but it's the Hippocratic Oath. You take care of the ill, you promote health, you relieve the suffering, and you try to do no further harm. But we as doctors, we are trained, to treat a disease, and not necessarily a patient, maybe. As a patient, I'm treated with systemic therapy, so I take a pill a day. And with this pill, there are a lot of adverse effects, toxicity. So along with cancer treatment comes along a lot of adverse effects. And well, the end justifies the means. You want to get treated for your cancer, so you in fact accept those effects. So I'm tired. I have a rash. I look maybe healthy, but it's just an adverse effect. I have a purple nose, looking like a drunk, which I'm not, at least not every day. I have attacks of diarrhea. So I always scan where the restrooms are, otherwise I may accidentally shit my pants. I have this strange voice, and nobody knows what the reason is, that I have a paralysis of one of my vocal cords. And of course there's the coughing. So sometimes I break a rib. Well, lately, I think the last 6 months, there's no tumor detected in my body. So as a doctor, I'm really happy. I'm happy for, well, the treatment is okay. But as a patient, I don't want to sound dissatisfied, but well, I can't work 100% anymore. I work 70%, and physical exercise is becoming more and more limited. No tumor detection doesn't mean that I'm cured. In fact, there's always a big chance that it will recur. So every little pain I can't explain scares the hell out of me. And what can I do with it? I can't call Jack every day and say I want a scan. I never realized this as a doctor. My hypochondriac friends, they really understand me now because they want a scan every day as well. So how do you manage this? Well, now that I'm a patient, it also changed me as a doctor. For last week, I had to take a biopsy, so a tissue sample from a 20-year-old female. She had colon cancer, bowel cancer. Too young for, but she's too young. It's very rare for that age. And normally, I just discuss technical aspects of a biopsy. And now I started, kind of interviewing her, how she was handling and what her plans were. And she said, well, it's my life, it's my body. I want the surgeon to cut it out. Well, I totally agreed with her, but I also advised her to, to listen to the options the surgeon can deliver. The tricky part of treating cancer is that it's based on scientific proof. So you treat with protocols, guidelines, and preferably you include all the patients in a trial, so to generate all kinds of data. I think the risk is that it's also a little, tunnel view, that it's kind of rigid. Patients expect the doctors to advise them. So as doctors, we really should, look into what the demands are of the patient. Not only look at a disease in a technical way. I think you should discuss all the options with your patients, also outside the guidelines. Even whatever you find on Dr. Google. I'm not saying that Dr. Google is a really good thing, but Suzanne Baars will explain you later on that there are many life-saving data you can find. So discuss the pros and cons and try together to team up and and find out what's maybe the best way for treatment. You got to realize that the quality of life is decreasing anyhow. So now I want to take you a little further in the disease. There is no, the course of disease is probably that you will die. So there will be a moment that there are no treatment options anymore. We as doctors are used to treat people, treat diseases. We're not so trained in discussing death with patients. So for us, it's always easier to discuss a phase 3 trial, which means, in fact, that the patient becomes a guinea pig. It won't benefit from the trial, but the data generated will probably help patients who have the same disease in the future. But I think doctors should take the responsibility to also discuss the moment that, well, enough is enough. Concentrate on death or upcoming death, and, well, saying goodbye to your loved ones takes a lot of time. A week or a month is probably not enough. So as a patient, we also should take our responsibility, realize that, clinging on to life is a great good, but, well, sometimes quality of life is not acceptable anymore. So instead of a fatiguing phase 3 trial, you should consider, well, kind of try to live to an happy end. That sounds a little strange, maybe. So I'm not afraid to die. I'm happy I teamed up with my doctors. I have an acceptable quality of life. And maybe patients should not ask their doctors how long they will live, but they should ask the doctors how they will live. Thank you.